All right, so this is our third video for chapter 9. So I was saying cardiovascular disease, that's the number one. Cardio issues are the number one killer in the United States. So it's kind of fun to learn about it. Of course, disease is not fun, but it's kind of fun to go, oh, if you hear about a stroke or if you hear about an aneurysm or, balloon angioplasty or EKG, when you hear about these things, it's like, what are they talking about exactly? So this chapter talks about those issues. So again, aneurysm, it's when the blood vessel kind of balloons, okay? And it can be dangerous because it can rupture. And if it ruptures, then there's bleeding and there's internal bleeding. And I remember being a little kid and going, internal bleeding, what's the big deal? It's blood inside the body, right? Well, the big deal is if the blood is pooling here, it's not going to where it needs to go. It's not going to the legs. It's not going to the head. And now those tissues start to get damaged, right? Because they're not getting the nutrients that they need. And that can quickly lead to death, right? So some other issues, again, they're kind of interesting. Angioma, right? So this is a benign tumor, right? But it's blood, right? So blood filled here. Okay, so it talks about arteriosclerosis, atherosclerosis, there's a difference, hardening of the arteries, fatty plaques in the arterial walls. So you hear about atherosclerosis, you hear about arteriosclerosis, atherosclerosis. That's not a good thing because the vessels, if there's going to be fat buildup, now they're not as stretchy. And when they're not as stretchy, they can get damaged easier. Or the lumen, the inside, can get smaller and smaller, so it's harder for the blood to flow through, which makes it harder for the heart to work, which makes hypertension more likely. So all these different things that can go wrong. So here it says arteries can gradually become stiff and lose their elastic recoil. Aorta arteries supplying the heart and brain are generally affected first. And then again, if those vessels aren't doing what they need to do or there are issues, now the tissues down the line are going to be affected. Arteriosclerotic heart disease occurs when arterial vessels are marked by thickening, hardening, loss of elasticity. So that causes reduced blood flow, elevated blood lipids, defective endothelial repair. So issues that happens because of that. Temporal arteritis, when the artery gets inflamed. So they're showing it. This is temporal, so with the temporal region. Epicardial pacemaker, epi, right on top, cardial. So if you ever wondered, if someone's SA node is not working properly, they could put a pacemaker, and literally they put it right under the skin, so it's like a little patch there. And then they can have nodes that, excuse me, that will stimulate, right? So it shows the little line here, and they'll stimulate the SA node so that they have a nice regular rhythm. That's if the SA node's having issues. Here, auscultation, so they're listening for the heart, right? So they're listening to the heart sounds, and we've probably all had this happen, if you've ever had a physical. Cardiomyopathy, so cardio, heart, myo, muscle, pathy, we're talking about disease, right? Oh my gosh, look at that. Does that look healthy? No, it's not healthy. It says an enlarged heart showing the results of cardiomyopathy. So yes, so if the vessels are narrowing and narrowing, there's more pressure and the heart has to work harder. And so that can cause an enlarged heart. There are different reasons for an enlarged heart, but that could be one of them. Coronary artery bypass. So remember we talked about the coronary arteries. They're the vessels that bring blood to the heart wall itself. So sometimes they have to do a bypass, right? So that shows it. Here, normal artery, normal blood flow. So here's the artery, here's what's called the lumen, right? And the blood's flowing nicely. Well, what happens? Vessels can constrict. That's normal. They can constrict. They can dilate. Okay. But if there's plaque, if there's the fat, right, arteriosclerosis, that plaque makes the lumen smaller. There's the narrowing, okay? And so that's going to affect blood flow. That's going to affect the tissues down the line. They're not getting as much nutrients as they can. Now affects blood pressure. There's more pressure on the walls. And then it's going to affect the pump that's trying to pump the blood through this area. So atherosclerosis, so that can happen with the coronary arteries, right? And you can imagine the blood flowing to these tissues, there isn't that much blood flow, they're not getting the nutrients, and that can cause a heart attack, right? Myocardial infarction, that's what a heart attack, what they call a heart attack. Here, what if the heart has issues and it stops pumping, the sinoatrial node, the pacemaker cells? So they can use what's called a defibrillator. And what it does is it shocks the heart to try to get it back onto its rhythm. Kind of stops the heart to try to get it working again. Actually, we have defibrillators on campus. They have defibrillators in major areas. And if you've ever taken a CPR class, right? They show you how to use a defibrillator. It's actually super easy to use. It tells you exactly what to do. It'll check, the machine will check, you know, the pulse, the heart rate, and it will not shock a person if they don't need it. It will only shock them if they do. And you have to not be touching the person. If you touch the person, this technician is touching the pads, not touching the actual person. If you're touching the person when you shock them, you get shocked too. And it is painful. It is not fun. Here, what can cause heart disease? My gosh, I don't know if you ever heard. If bacteria get into the blood, it can affect the heart. It says how microorganisms enter the bloodstream and affect heart lesions, which can result in bacterial endocarditis. Endo, we're talking about the inside. Cardi, we're talking about heartitis, inflammation, right? So dental infection, that's why it's important to have good teeth, good gums, clean them, because that can actually affect the heart, which is insane to think. Skin infections, respiratory infections, urogenital infections. Because if the microorganisms get into the blood, it can get to the heart and it can cause heart problems. Yay, just what you wanted to hear, right? So heart failure, one of the most common types of cardiovascular disease seen in the older adult. Congestive heart failure or left side failure. Usually it's the left side because the left side has to pump through to the whole body. Okay. Pulmonary edema, is excess fluid, swelling, dyspnea, shortness of breath. Of course, if the heart's not doing its job, then the blood kind of backs up and then you get inflammation or you get tissue swelling, edema. Shortness of breath. Well, why? Because now the lungs are trying to get the blood oxygenated and you're having a hard time and get shortness of breath. Right ventricular heart failure usually occurs as a result of left side failure, increased fluid pressure, ultimately damage to the heart's right side, liver enlargement, distension of neck veins, edema of ankles, swelling in the ankles. So here are the signs, right? Anxiety, of course, things aren't going well. The person's going to feel anxious. Persistent cough, right? Because if there's fluid in the lungs, you're coughing it out, trying to get that out. And that's because the blood is backing up and then there's fluid getting excessive there. Heart rate, yes, the heart's trying to do its job and it's not doing a good job. So the brain's going to increase heart rate to try to get it going, right? Rapid breathing again. Cyanosis, cyanotic, the person looks blue. Like that's a real thing. Because if the blood's not getting oxygenated, that's what gives the red color to the blood. Now it looks blue and the person's tissues actually look blue. Edema, that's swelling. Upright posture, leaning forward, trying to breathe. Okay, because the heart and lung work together. Hemangioma, right? So again, this is a tumor, different types. Hypo, below, right? Tension, so low blood pressure. Okay, so what can cause hypertension? Hyper means high blood pressure. Smoking, not good. Smoking damages the blood vessels. Being overweight, not good, because now there's more fat, more blood vessels, harder to get blood throughout the whole circulatory system. Lack of exercise. Exercise is so good for you. So good for you. Stress, alcohol. Also, there's heredity. I know people who are totally healthy, don't smoke, eat well, blah, 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 and they still have hypertension. So genetics can play a role. Race can play a role. Gender. Males are more likely to get hypertension. Age, as we get older, more likely to get hypertension. Oximeter, right? Whenever we go to the doctors, they can check our blood saturation. So it uses light to figure out how saturated your blood is. Balloon angioplasty. So if someone's blood vessel is clogged, they can put a catheter in there and they can blow up this balloon to try to push the fatty plaques to make the vessel wider. Phlebitis, vein inflammation. Pericardiocentesis, taking fluid. Sometimes there could be excess fluid around the heart, so they could do that. Here, this syndrome, right, where there's problems with blood flow with the fingers. It says discoloration of the thumb and fingers. There's something definitely wrong with the circulation. Shock. You've heard of shock before. It's like, what is that? Well, when you're not getting blood to the tissues, basically. So someone can have really, let's say they get cut and they lose a lot of blood, they can go into shock, okay? Why? Because they've lost blood, yes. So it says rapid breathing, shallow respiration. Again, trying to get the oxygen. Anxiety, lethargy, confusion, again, tachycardia. So the heart is going to go really fast, trying to move the blood if possible. Thready pulse, low cardiac output, low blood pressure, low temperature, thirst, pale, clammy, cool. A person can die if it's not fixed, okay? A stent. You may have heard of a stent, so like that balloon angioplasty, right? But they actually put this mesh inside the vessel to keep the vessel open. So that's what a stent is when they talk about it. Again, another issue with blood flow. Here, thrombophlebitis. Thrombo, we're talking about a clot. So if someone has a clot in the vessel, and what can happen to the skin, clots can be really dangerous. Clots are a natural process. It's just if you have too many clots or the clot doesn't relieve itself, now the clot would be like something in the vessel and it can leave and it can go to the lungs, and then that could be life-threatening. So they show a thrombus or a clot, right? So it can cause problems, narrowing of that lumen, or actually completely, totally, it says occluding, so blocking the lumen. Varicose veins, what's happening? Those little valves in the veins, if they get kind of loose, the blood starts to pool, and then the vein gets kind of big, and then it bulges, and that's what a varicose vein is. Okay, now drug highlights. You can look at different drug highlights, kind of really interesting. Some of the things we use to help with cardiovascular issues. So take a look at them. Diagnostic tests, angiography, catheterization, right? So they show catheterization here. Different types of tests that they could do. EKG or ECG, looking at the heart. Literally what that's looking at is the electrical impulses and does it look good, between the SA node, the AV node. Different types of diagnostic tests, MRIs, PETs, stress tests. You've probably heard of those. Triglycerides, we're talking about the fats, CT scans, and then some abbreviations. And that finishes up this chapter. Again, this is a pretty big chapter. And again, cardiac is a big deal. So you guys should look at it and pay attention to it. All right, we'll see you guys later.